Donald Chu is the principal of BenefitDeck and has worked in senior positions in the employee benefits field since 2001. Over the years, Donald has consulted with a wide variety of clients, ranging from small businesses to association plans and large companies. Helping clients address and implement sound, viable solution is the most satisfying part of the process for Donald. Donald is currently writing the Canadian Health Assurance Handbook with the goal to help employers navigate the increasingly complex landscape of providing health insurance for their valued employees. Donald holds the Certified Employee Benefit Specialist designation, has completed executive leadership courses at UBC, and has a Bachelor of Business Administration degree from SFU. Within the community, Donald has led fundraising efforts for the United Way, Big Brothers, and the Salvation Army. Donald and his wife Anne are expecting their third child in a few weeks.
With trends in inflation, you hear a lot of industry lingos about trends, inflation, and a lot of that means the same thing. You know, it just means the cost is going up. Your cost is going up, right? So I was actually at a Bank of Canada conference a couple of months ago, and their target inflation rate is 2.5%. Now that's all good. Now when you talk about healthcare, that's a whole different story. Well, why? That's what we're going to talk about today. So healthcare inflation is actually at 11.5%. And I say that, and you probably read ahead here, that it's actually been tapered down from 15.5%. A couple of years ago, as I was, as part of the job, preparing renewals and writing renewal reports for clients, 15.5 was the norm, and higher actually, some even 17%. But in the last year and this year, that has come down, and that's a good trend, but still high. 11.5% is still high in terms of inflation, and we're going to get into why. Okay, and dental is at 5.5. That number used to be 8.5%, so that has come down as well, but still higher than the general public inflation number. And so causing the average rate to be anywhere from 7 to 10%, because in an average plan, you would have health, you would have dental, you would have long-term disability, as well as some life insurance. So you average that out, even if you claim where your insurance company wants you to claim, they're going to give you an increase. So that's, in a nutshell, what I want to kind of drive the point today. In terms of the cost drivers, there are, we've come up with 10 of them. Aging demographic is nothing new. We're not getting any younger. And so that's number one. Number two is the stress and mental health. That's been the case for the last, I'd say around 3 to 5 years. Stress and mental health has been creeping up towards the top of the list in terms of drug claims, and a lot of the insurance providers are actually providing more resources. Ceridian is an example, as well. Great West Life and a few others actually had a dedicated resource website, because there's so much stuff on Google and on the internet, and you just don't know which one is relevant, which one is not. So it's actually important to have a dedicated resource from experts, people who actually are qualified to input that content. We live in BC here, and there is a public plan, right? It covers drug programs, it covers doctor's visits, covers hospital visits, and it's great. But what's been happening is that the budget, healthcare budget as a percentage of provincial healthcare, or of a provincial budget overall of general revenue, is increasing every year. So if you talk about like a year 2000, it's about 40% of the total government expenditure in BC. And more recently, the latest figure has been 66%. So it's been creeping up every year, slowly but surely. So because healthcare cost is increasing, there's a shift from public to private. And guess what private means? It means you as an employer are going to have to pick up the tab. So that means your cost is going to go up, because the public plan is already shifting towards a point where it's covering less. Focusing on the cost drivers. Number 4, higher incidence of chronic diseases. And we're talking about diseases like, I had the privilege of working with a client, and this gentleman, bless his heart, he's got scaling and Crohn's disease. So if he doesn't take this drug called Remicade, his skin starts to scale. And he told me in graphic detail. I was in his office. So Remicade costs $72,000 a year. Well, does the government pay it? In his case, no, right? But we were able to get the government to pay it through a special process. So there was a lot of paperwork to fill out, a lot of specialist paperwork and things like that, making sure, I think the province want to make sure that they have tried every other way rather than just going straight to Remicade. But there are ways to get the system to pay it. And that's what we're here for, right? So higher incidence of chronic disease, that's a huge cost driver. Now, the industry is doing something. The insurance industry is pulling together all the drug claims to try and mitigate that cost. But so far, it's a constant battle with the higher drug cost because plans are not priced to pay for that. We've got an open drug plan that covers all as well. That used to be fairly common. If you look at benefit plans in the 90s, you know, you've seen one plan, you've seen it all. You know, they used to be all the same. This field is getting so much more complex that one drug plan doesn't cover it all. So it used to be that you have a plan that covers anything, right? Anything and everything prescribed. But now there's more restrictions. Some of the providers are changing the ways that an authorization is made. Without getting too much into technical details, you know, they would prescribe the process within how you would go about getting that drug covered. And in a lot of cases, it's reducing the number of brand name drugs so that people will go in and fill it generic, making sure, providing incentives to make sure that people would go to a pharmacy that would charge less dispensing fees. And those are all great things, right? And number 7 is the, same line, lower generic fill rates or no generic substitute. A lot of these new drugs do not have a substitute. So if you come up with a new drug, right? You would have, in the States, 17 years of patent protection, around the same for Canada, and you're good, right? You're good for 17 years. Nobody could copy your drug because that's the protection that you have for spending the research and development, and that's huge dollars, right? Pharmaceutical companies, big pharma as we call them, spend billions and billions of dollars into developing these drugs that cure. And that goes to, I'm just skipping to number 10, medical advances that cures these illnesses, but that's costing you. So you get the idea here. Number 8 and number 9, lack of communication. Whether you, as an employer, want to care or not want to care, I know you all care because you know, a lot of you are my great clients and you're attending today, but some may not care to a point that these plans are costing them, and that their solution, the short-term solution perhaps, is just to shop it every year to get them a low rate. What that gets you is 1 year savings. That's the exact thing that you don't want, because what happens in 2 years is that they're going to catch up on the savings that they provided for you, and they're going to increase it where you should be, right? And then in the meantime, you can't really go anywhere because nobody quotes you after a year. So that's the dilemma that a lot of business owners, that's the difference between group benefits before and group benefits now.
Many of us are concerned about the bottom line in our organizations. However, full-time employees, for instance, will miss 9.1 days for most illnesses or disability, and the rest for personal or family reasons. We've all heard about burnout in the workplace. The cost of that is estimated at $12 billion in every year in health and productivity costs. By investing in employee wellness, we would encourage you to consider that as part of your comprehensive benefit plan to ensure your employees have access and their families have access to the appropriate support when they require it. Thank you very much.
So Al made a really good case on the wellness programs. I won't get into very much details here, but wellness programs saves you money. And we're talking about employee assistance programs. We're talking about wellness coaching. We've got solutions to the predicaments that we're in and the cost increases. So you want to make sure that your employees are aware of what's happening, right? So I've heard sometimes, that some companies like to bring in massage therapists towards the end of the year, and it's a nice thing to do for the employees. And the massage therapists would obviously build the extended health care plan, and they would go around and giving massages to everybody. And it's great business for massage therapists. Nothing wrong with that, and they probably do a pretty good job as well. But know that as an employer, it's going to cost you. Right? So, yes, you could say that there's maximums and things like that in place, but do you want to promote usage? Right? You put a plan in place so that they could use it, obviously, right? So if they do have a sore back and things like that, that's great, right? Go use it. But if they have a plan, and they get into a habit of maxing out every single paramedical practitioner. So you give an example, 500 on chiropractor, 500 on massage, 500 on physiotherapy, 500 on naturopath. Hey, that could add up pretty quickly if everybody's claiming, right? So, and do you want that as an employer? That's a question you want to answer, right? Because when it comes to time, when your benefits broker or consultant comes to deliver your renewal to let you know that, look, here's the usage and here's what the insurance company needs, who's paying the bill? Right. So anyway, I just wanted to make sure that you're aware of that. So employee education is definitely, and communication, that's definitely a key piece here to make them aware and understand what is available and, what are some of the resources that are available to them as well. So communication is key here. And at the end of the day, you want to make sure that the employee feels that you do care. Going back to the engagement, where we start off in the beginning, you do want to make sure that they know that you care. One of the services that we provide is benchmarking to make sure that you as a company, measuring up to the industry and what the industry provides, that you would know that what your plan is measures up with the rest of the industry. So if that's the business strategy that you want to pursue, you want to at least match that or be better if you want to attract the good staff. You want to make sure that you work with somebody who monitors your claims, not just quarterly, but if you're a big company, probably monthly, and making sure that if they see any red flags, to report back to you on, let's say mental health is high, or let's say the drug use has been high, what has been happening? Is there a pattern developing? So that's basically very important as well. Open communication with your benefit consultant, I can't emphasize the importance of that. And plan design. Plan design is another kind of lever that you could pull that allows you to, at the same time, provide better benefits for your staff and at the same time, implement some cost control as well in terms of plan maximums and things like that. Well, thank you for tuning in and I appreciate the time. And if you have any questions, feel free to check our website. Our contact information is in there. We'd be happy to serve you. And if you wanted to have me as a speaker as well as bringing in other experts, we'd be happy to do so as well. That's part of the service. And if you're a client of ours, or if you wanted to explore some more with our company, I'd be happy to do so as well. So long. Thank you so much. And until the next episode, thank you from BenefitDeck and thank you for the speaker as well. Thank you.